Hi, this is Marty Stempniak, staff writer for Hospitals and Health Networks. I'm joined today by Dr. Steven Stack, who's set to be sworn in as the 170th president of the American Medical Association. Dr. Stack is an emergency medicine physician from Lexington, Kentucky, and he's actually going to be the youngest AMA president in 160 years. Dr. Stack, thanks so much for being with me today.
It's a pleasure to be here, Marty. Thanks.
Our primary audience for the magazine is hospital leadership. The AMA and the AHA recently released a report going into how hospitals can better integrate their leadership with physicians. Could you just talk about, for the hospital leaders, how important it will be for them to use the guidance of physicians when setting their strategic direction during this time of transformation in healthcare?
Right. So we're very proud of that work with the AHA. We think that the AMA's efforts overall are demonstrated by an interest and a willingness to collaborate and cooperate with others, all for the higher purpose of providing better care to patients and supporting physicians in the provision of that care. So this partnership with the AHA is of particular joy to us, where we have come together and worked between our respective boards to come up with a document that describes high-level principles that would be included in a constructive relationship between physicians and non-physician leaders in hospitals and health systems. And it's built on mutual trust and respect to the contributions each member of a leadership team brings, and the need to make sure that all participants in the leadership of hospitals and health systems are given the information they need and the opportunity to participate and contribute in meaningful ways. Additionally, it also outlines some of the responsibilities and obligations of the different parties so that the physician and the non-physician leaders can appreciate their obligation on both sides to be constructive collaborators and meaningful team members. So we think that that is but a first step to demonstrate that it is possible for doctors and hospitals to come together in new and innovative ways to show the way forward, and we hope it's only a first step. We hope there are many more to come and that there can be a rich collaboration so that patients know that their doctors, their hospitals, and the other clinicians in the health system are pulling together to work and put the interests of the patient first and foremost for all of us, because that's what we're all here to do.
Burnout of physicians has been a big topic of conversation this week. Could you talk a little about why that's a focus for the AMA and how this recently unveiled tool will hope to address that?
Right. So physicians face an overwhelming burden and tsunami of regulatory issues they have to deal with the federal government and private payers. We also face electronic health records that have so much promise, but currently are far more interfering and impeding physicians' work. And physicians just feel that they don't have the tools and the resources they need in an overly complex medical delivery system. And so the AMA is committed to understanding those challenges, to finding those things that most interfere with patients and physicians working together for the patient's health and wellness, and to creating tools that will help physicians to navigate those complexities, to have more productive practices, to have sustainable practices, and really, quite frankly, to restore the joy to the practice of medicine. We want physicians to love what they do supporting their patients, and we really do believe happy, healthier doctors will lead directly to happy, healthier patients.
Dr. Stack, you talked earlier about the tsunami of regulatory change that physicians are facing over the next decade. Could you go into that a little more, specifically with respect to ICD-10 and meaningful use and how the AMA hopes to alleviate some of that stress that docs are facing in that regard?
Sure. So the first thing is to put it all in the total context. So we have meaningful use, ICD-10, PQRS, value-based modifier. We have now a new schema from the Medicare reform legislation that just passed that will link some of these together to try to bring more rationality and internal coherence to those programs. There's an incredible tidal wave of burden in this area. So to the two areas you specifically addressed, meaningful use has helped physicians and hospitals to adopt health IT more rapidly. That's a success. It has also created many challenges because it forced an entire industry, 1/5 of the economy in healthcare, to adopt tools that were not ready for prime time and have arguably caused more problems than benefit at this moment in time. That being said, the AMA and I believe physicians are committed to health IT done well. We want to make sure patients have access to their data when they need it, where they need it, and we want to make sure physicians have access to patient data where they need it and when they need it to provide the highest quality care. ICD-10 is an incredible challenge. It's a 400% explosion in the number of codes we will use to diagnose disease with the coding system. 17,000 to 68,000 codes. It is the single most monumental change to the electronic coding system we have ever done as a health sector. Even the proponents will acknowledge that it's an enormous and monumental transition. We are going to have to work very, very hard with CMS to make sure that in this change, we don't cause incredible disruption to the millions of patients who see physicians in the United States every day and the physicians themselves who are providing care. So we continue to have great concern that ICD-10 is a series of risks and costs not supported in return by the benefit that it will produce. That being said, we acknowledge that so many others in the health sector say we're going to move forward, and if that's the case, we are committed to working with CMS and others to making the transition as smooth as possible, and we'll keep up those efforts.
Dr. Stack, thanks so much for your time.
Thanks, Marty. It's been a pleasure.
For HNHN, this has been Marty Stempniak.